Migraines themselves are actually a neurological condition. Migraines can be triggered by a wide variety of things, actually. So it can range from food triggers to environmental triggers to internal triggers. So that could be things like stress and neck pain for some people, whereas it might be more like wine and bright lights for other people. We also have very clear evidence that exercise is the best way to treat migraines. So it's kind of a double-edged sword. Another classic one is people might have a different leg length. One leg might be a couple centimeters longer than the other, and as long as it's just a couple or one, that is actually totally fine, and there's a good chance that you don't need any correction, and your body is adaptable and variable. And just because you have pain and you have that difference in leg length doesn't mean that that's causing your pain. It's likely driven by a lot of other things.
Welcome back, everyone. My name is Alejandro Santillan, and today we have Dr. Dylan. By the way, this is the Wellness Podcast, the Holistic Habitat Podcast, and we're here to support you on your holistic journey where mind, body, and spirit work together for that desirable change you are looking for. So today we have Dr. Dylan. I would consider him as a migraine specialist. But tell us about yourself. Tell us why you decided to go towards this route of becoming a specialist. What's so special about that side, that spectrum of the wellness side of things? And then, of course, talk to us about who you are as well.
Yeah, well, first of all, thanks for having me, Alejandro. I appreciate it. Excited to be here. Well, my background is a little bit complex. I became a physical therapist a couple years ago, and I decided to pursue some further education, and I did an orthopedic residency. And through that process, I discovered that a lot of the issues that people were coming to me with, regarding migraines were actually treatable and not just something that, their doctor took care of. And this is actually something that I personally used to struggle with a lot. I grew up having pretty horrible migraines, often, every couple days at the peak of it. And so, when I discovered that this was something that I could actually make a really big impact with, I started to focus it in my clinical practice. And so now I've helped dozens of people, probably more actually now, who struggle with migraines, basically start to take ownership of that condition. And I've seen huge improvements. And so I'm transitioning from working in the fully like in-person one-to-one model to more of an online space to help more people with it, because I realized that a lot of the things that I deliver are not exclusively requiring in-person care. And so I've really done a deep dive into the literature and found all of the most kind of cutting edge literature to find the best approach for managing this stuff. And so I figured, why not venture out on my own and explore the space of helping people through this in a more long-term model. I like to think of this as people are investing in their future, and sometimes change takes time. And I think your branding does it best, talking about the holistic approach. That's my bread and butter. That's the way forward for all of these conditions, but especially migraines. So that's how I approach it as well.
And why do you think, what's the common triggers for migraines, and how can someone identify those?
Yeah, that's a good question. So migraines can be triggered by a wide variety of things, actually. So it can range from food triggers to environmental triggers to internal triggers. So that could be things like stress and neck pain for some people, whereas it might be more like wine and bright lights for other people. So some of the big ones would be red wine, dark chocolate's a really common one, alcohol, things like really sudden high exertion. So like if you had to run up the stairs to a meeting because you were late, and so you have stress and you have this high sudden exertion, that can be a trigger. But there's a ton of different triggers out there, and actually it comes down to assessing the individual and finding the triggers of that person, because everybody's is going to be a little bit different, and figuring out an individual's is really the key.
Mhm. So you're saying that even exercises can trigger a migraine?
Yeah, that's actually a tricky thing to navigate sometimes because exercise, um, if somebody's not doing it in a way that's necessarily very controlled or very well informed, can be a trigger. But we also have very clear evidence that exercise is the best way to treat migraines. So it's kind of a double-edged sword. That's how I like to put it because if you just start full throttle like you did back in high school, then you're likely to set off a migraine episode. But if you're able to work into exercise, starting with maybe just neck exercises or maybe just some steady state moderate intensity cardio, where you're tracking your heart rate and assessing, making sure you're not going above a certain threshold that you identify with testing, especially if you have like a wearable device, something like, one of the Apple Watches or one of the what's the other one? Well, I don't
Or
know.
ring?
Any wearable that assesses your heart rate. Oh yeah, that's right. um, and so as you're training, you can identify like, or maybe you had some history and you're like, oh, I got a really bad migraine several days ago, and then you look back at your heart rate and you realize, oh, there was a huge spike there when I was maybe running around with the kids in the yard, and then you're like, oh, maybe it was that threshold, and so you start training below that threshold, and then you slowly progress over time. And
Hmm.
so, exercise is cardiovascular in nature and resistance training, as well as some specific neck and head exercises, can be profoundly helpful for reducing the burden of migraines.
So I'm speaking for a lot of people on this one, because I don't necessarily can't differentiate the difference between a migraine and a headache. So what's
Yeah,
the difference between those two?
that's another great question. You're bringing them to the table today. um, so, a migraine is really so much more than a headache. There's a lot of overlap. You can have regular headaches if you have migraines, and you can have, or you could have no headaches at all and still get migraines technically. So I think it helps to understand that migraines themselves are actually a neurological condition in that
Hmm.
it involves a specific nerve in your, it comes from your brain. It's one of the cranial nerves. It's called the trigeminal nerve, and it
Hmm.
innervates your forehead skin here, your kind of lower cheek area, and your jaw in the ophthalmic, maxillary, and mandibular branch. And then it also innervates some of the stuff like your chewing muscles, some of your ear, and then the lining over top of your brain and some of the blood vessels in your brain. Um, and so when that nerve gets sensitized, it basically is able to spontaneously erupt when this neurological activity. It's one of the only nerves that can do this because it's called ectopic firing, but essentially what it does is it dumps out this really inflammatory chemical called CGRP, and CGRP increases the blood vessel diameter. So if the blood vessels in your brain are like this, then suddenly they can really open wide, and that's why you get that throbbing, pounding headache that's usually
Hmm.
on one side. But it also kickstarts this crazy process. It's like a rolling wave of neurological activity in your brain, and that is called cortical spreading depression, which essentially leads to the weird sensations that you can get. So sometimes people with migraines get something called an aura, which is like you might get numbness on a part of your body, or you might get squiggly lines in your vision, or you might lose your vision altogether. Sometimes you get weird sounds like ringing in your ears, which is called tinnitus, or you can have other things like just confusion and nausea. And so all of these symptoms come together that make it pretty clear that it's much more than a headache. Although sometimes people just get headaches too. So it's, a migraine can be a wide range of things. Sometimes it can even present like a stroke. Some people get, it's called hemiplegic migraine, where one side of your body goes kind of weaker and numb, and you start to have visual changes, and you might even have some facial drooping, and that can be really scary for some people. So this is a very serious condition, and it actually is the second leading cause of disability in people, just behind low back pain. So it's a very, very relevant condition, and much more serious than just a headache.
Wow. I didn't even know that there are different types of migraines. I just
Yeah.
thought it was just a migraine and that's it.
Yeah, there's tons of them. It's actually a family of conditions. It's got a lot of different versions out there. And so actually finding the right diagnosis can be really important. So working together with your physical therapist and your physician, you can kind of start to piece together your triggers and your symptoms and create a clear picture, which can be helpful for identifying the right path forward and your treatment. So
Mhm.
it's it's helpful to have a better understanding of the different types.
Okay, so with any of those signs, you recommend them to go to a physician or someone that can diagnose this?
Yeah, so your general physician, just your family doc, they're going to be probably the first line of defense. And actually, migraines are massively underdiagnosed. So if you're dealing with frequent headaches, it may be a migraine, and that shouldn't be scary. It should just be helpful in understanding that there's things you can do about it, and start by talking with your physician, or if you're already seeing a physical therapist who treats migraines, you can do that, or if you can get in contact with a neurologist, that is also a great option. They're generally harder to come by though. It's an underserved branch of medicine, so there's not a lot of providers out there that are ready to take on new clients, and it can take months to even sometimes it's like half a year to get into a neurologist. So starting with your general physician is a good idea.
So do you think this is a very common thing amongst us?
Yeah, it's surprisingly common. It's actually about 15% of people are getting migraines. So it's a it's pretty significant. It's one of the highest sources of headaches in people, and it's one of those things that is remarkably relevant for people, but is underappreciated in our medicine system. So our whole medical system is not really taking this as seriously as it should be, and so it's undertreated and underdiagnosed by far.
Okay. I don't know if you already tapped into this, but if someone doesn't do anything about it, will they just suffer with migraines the entire life, or can this lead to something much major?
Yeah, that's a great question. So the migraines sometimes will just go away on their own. As in,
Hmm.
obviously one migraine will stop, but a series of migraines, you may have migraines for just a period of time in your life, but sometimes if left unchecked, because your brain is actually always in tune to different sources of stimulus like this, and your brain is what's called neuroplastic, meaning your brain can adapt and change with given challenges it's facing. And so if you're having repetitive pain like frequent migraines, it can actually kind of convert into something called chronic migraine. If it's less left unaddressed, it can get to the point where it's happening multiple times a week even, and can lead to serious disability. So it's something that should be addressed if you're experiencing this, and the right approach is absolutely essential in making sure that it doesn't get out of hand. But a lot of people experience just, maybe it's a chunk of time in their life where they get migraines and then it goes away. But it can be extremely frustrating to manage on your own. So it's pretty common for people to try to fight through it, because it's kind of hard to know what to do, but it can just go away. So it shouldn't be something that you're overly stressed about. Conversion to chronic migraine is not exactly very common, but it is a very serious, risk.
Yeah. It's funny you said you said there's something you shouldn't stress about, which can actually make it worse if you stress about
Yeah,
it,
yeah,
wouldn't it?
exactly. Yeah. So that's actually a great point, and that gets back to this holistic management style that we both love so much.
Hmm.
The stress management, and especially something called autonomic regulation. That's the fight or flight system and the rest and digest system. Those are your autonomic nervous systems. And there is pretty clear evidence that your autonomic nervous system is related to migraines. So being able to regulate yourself in that, if you get seriously stressed, using strategies like mindfulness training, slow exhale focused breathing. So like the 4-7-8 breathing method, or even just a box breathing, which is a 4 count inhale, 4 count hold, 4 count exhale, 4 count hold. Um, those are all excellent methods for approaching some stress management strategies. But yeah, stress is absolutely relevant in in this condition, and is absolutely a trigger for a lot of people. So finding methods to help to reduce your stressors in life. It may require some more drastic approaches, but generally speaking, most people can start with just trying a mindfulness practice on a regular basis. It can be as simple as starting with 5 to 10 minutes a day, or even 5 to 10 minutes just once a week if that's all you can find time for. But whatever you can do, working in some mindfulness training and breathing exercises can be profoundly helpful.
What about other alternatives such as acupuncture?
Yeah. So acupuncture and something called dry needling. I do dry needling because there's a subtle difference there in that we both use the same needles. Acupuncturists are performing traditional Chinese medicine, and dry needling is more of a westernized medicine approach, but they're both using needles to puncture the skin. They're the same needle, but different thought process in the needle placement. And acupuncture and dry needling can be very effective in management of this, especially because a lot of people tend to get pain at the base of their skull or the top of their neck. Um, that can contribute to this migraine process through something called cervicotrigeminal convergence. And I can talk more about that going forward if you're interested. But um, dry needling to the suboccipital muscles, as well as some of the muscles in the head, and as well as some of the nerves. So that I talked about the maxillary branch of the trigeminal nerve and the ophthalmic branch. Those nerves are very relevant in this process. So doing some needling in these key points. And so oftentimes people will get pain here or pain here and then pain here. And sometimes people will get pain radiating into their teeth with headaches and migraines. So that's very helpful. There is also a superficial exposure of where the vagus nerve. So the vagus nerve is one of the cranial nerves it's the biggest nerve relevant to the autonomic regulation, the autonomic system. So the parasympathetic control of all your organs in your trunk. That comes from the vagus nerve. And that vagus nerve has a branch that innervates the outside of your ear here. And you can put needles just in the skin of that area, and it can help significantly with management of some of the symptoms, and can help kind of wind down the autonomic nervous system, especially with a little bit of electrical stimulation. But that's on the more controversial end of the spectrum. We don't have a lot of studies looking at that, but we do know that the nerve is in that region, and we do know that it has been shown through stimulation transcutaneously, meaning with a needle, it can change the electrical activity of the vagus nerve, and that nerve is very relevant for the migraine process.
The first thing that pops in my mind is bro science.
Yeah.
when, when, when you mentioned that part, I mean, have you done that before for yourself?
Dry needling.
Yeah, like for your migraines.
Yeah, and I've treated probably up over 1,000 people with dry needling, and it is remarkable. Like I treated one gentleman who he had migraine, or he had chronic headaches. This was not migraines, but it's still relevant. He had headaches for 10 years consistently without ever having relief from his headaches. He tried everything, and then I started treating him with a combination of neck strengthening, vestibular training, which is a training of coordinating your eyes with your ability to sense your position in space. And so, um, and so basically controlling your balance, but how your eyes relate to that system. And as well as pairing it with some dry needling to the base of the skull and some of the other cranial areas that I talked about briefly a minute ago. And he for the first time in his adult life, had relief of these headaches that he had been dealing with. He rated them when he first started at a 7 or 8 out of 10 constantly. So imagine like pretty close to the worst pain you could ever have all the
Hmm.
time. And we brought it well down below a 3 out of 10, but he had to stop because insurance stopped paying, which is one of the reasons I'm diving into the entrepreneurial space here, so I can avoid those issues. But it's it is definitely profoundly helpful in the right context for the right person.
And what's the first step when someone comes to you with these problems? What's the first thing you do for them? Like, do they have to answer a couple of questions? I mean, what is it?
Yeah, so the first step is basically getting a better understanding of how this is impacting your life, what sort of things you would like to get back to being able to do, um, and then kind of talking through some common triggers, talking through some things that you may or may not have found helpful in the past, and then kind of progressing through an assessment of where you're currently at in your ability to meet the pillars of migraine management. And some of those would be regular exercise training according to the ACSM guidelines. So that would be 150 minutes per week of moderate intensity cardiovascular training, or 75 minutes of vigorous intensity cardiovascular training, as well as 2 days a week of resistance training. So that's kind of my baseline threshold. If you're not above that, we probably need to work on that a little bit. Maybe not immediately, but at some point. And then we're going to consider something like hydration, super relevant there. We're going to talk about stress, nutritional triggers, and just baseline nutritional status. If your diet's not really that great, we can work together to improve that. We're going to consider things like supplementation. If you haven't tried supplementation with things like magnesium, CoQ10, or riboflavin, those are the three highest level of evidence supplementary supports that you can have for migraine management. But that's generally, I'd point people in the direction that can be helpful. But as a physical therapist, I don't manage people's medications or supplements, but I can provide the evidence that is out there about them, and then they can make a more informed choice about what they take, either themselves or with their physician. Um, and then we also will consider things like neck pain or injury history. And then we put together a comprehensive plan to address any stressors in your life, to address behavioral changes about nutrition, about hydration, about exercise planning in particular. So I have a background in I'm a CSCS as well as an OCS. So that means I'm a certified strength and conditioning specialist as well as an orthopedic certified specialist. And so I love exercise, and I am particularly keen on helping people to get into healthy habits around exercise. And so I create a program, and so it basically outlines, I look into people's history with exercise and figure out what they like to do, where they would like to focus their time, and what they would love to get back to doing more of. And then I create a program based around that helps to emphasize their um, developing some autonomy in exercise as well as consistency in meeting the baseline goals that everyone should meet. So yeah, it starts with assessment of all those things, and then we go from there to kind of build a plan. And it's usually the next couple sessions that we'll do performance assessment and check out people's baseline measurements for push-ups or neck strength, or if they're really into weightlifting, we may do something along the lines of a bench press 5 rep max, or if they're more comfortable with a 1 rep max, we can do that all the way up to squat testing, deadlift testing, maybe even some other cardiovascular parameters. But yeah, how do you actually go about your intake? I'm curious.
My intake. So would we go through is yes, the same thing as you, like checking out what their dream is, like what they're trying to aim for. Most of my clients will aim for just being more healthy, gain
Hmm.
muscle. And
Yeah.
so I will also do some testing as well to check out their forms. Uh, I know I'm not a therapist, but I do know a couple of therapy movements, and I also been to a therapist for my own injuries. So
All right. Yeah.
I know and they say that we are the best teachers, the one that get pretty much injured. We are the best teachers because we've been through that
Oh yeah.
struggle and we know how it is.
Absolutely.
I think it's pretty cool that you already been through that route of having migraines and you can actually empathize with people when they're having their own issues.
Yeah, I think people are sick and tired of going to doctors and being brushed off. So I think you're right. Having a both personalized approach as well as the ability to kind of empathize and understand the struggles that are going on, because a lot of people feel both that they're not getting the attention and explanations they need from their doctors, as well as not really feeling seen in this process. Because I think your question earlier kind of highlighted it, that a lot of people think it's just a headache, and it really is not, because it often leads people to vomiting and it leads people to being out of commission for 3 days, not being able to do anything. So it takes a real impact, and it can be an emotionally taxing experience. But yeah, I'm curious, what was your experience like in PT?
Very valuable. And with I had my first dry needling for my forearm.
Oh yeah.
I was a little afraid, but once you get through it and you see just the healing process, it's amazing. Like
Yeah.
it really opened my eyes in dry needling and how just doing that improved my forearm issue, because I had some tightness going on in my forearm,
Hmm.
and the guy said it's gonna feel weird, and
Yeah,
you're gonna be
it sure
sore
does.
in 24 to 48 hours, and but you'll be okay after that.
Yeah.
So I went through it. And I was like, yep, and it doesn't feel like crap anymore. It's not as
That's
sore
awesome.
anymore.
Glad to hear that.
Yeah, and then he incorporated with some therapy work, like some forearm work with the dumbbells.
Yeah, it's essential.
The root cause supposedly was that I strained it because of how tight, when I was doing like heavy weights, how tight I would grip the barbell or how tight I will grip the dumbbell, to the point that I strained my forearm.
Oh. And how long were you dealing with that? I'm curious. Was it like a
Ooh.
long period
Dude,
of time?
7 months I had that issue, and
Oh,
I never had anyone look into it until I just said, you know what, I got to find somebody, and
well, it's good you did, because it could still be going on.
yeah,
That
yeah.
sort of thing can creep up and linger. The Yeah, strains like that, and it sounds like you probably were having what's called lateral epicondylalgia, or um, it's called tennis elbow is another way to put it, but that is often a tendon issue, and so I think that loading strategy that he gave you, or they gave you, along with the needling, that's choice. Sounds like you got yourself a good PT there.
Well, I now, since I've already been through that process, I know that I can definitely recommend him in the Houston area
Sweet.
if they want to see someone like that, or if someone have migraines, they can go to you, right?
Heck yeah, I'd be happy to see him. Yeah. And
Now,
actually, just to kind of
yeah,
clarify, sorry, I didn't mean to interrupt you there.
no, go for it.
I am actually in this process of, you know, moving into the online space. I'm actually functioning as a coach rather than a physical therapist, but I am still taking physical therapy clients. It's so people who want to see me for a wide variety of conditions, welcome to shoot me a message or something. But um, the uh, the key difference with coaching and physical therapy there is that we are helping people to take ownership of all the pillars of their health, without necessarily emphasizing migraine treatment as we're not going to cure your migraine, but we will guide you through management of your symptoms. And if you want to go through more in-depth sessions and more in-depth personalized um, physical therapy approach, we can do a more one-to-one process that's a little bit more nuanced.
So if somebody is going through this, the constant migraines, there's like two questions popping up in my mind, and I don't want to forget the other one either.
Yeah.
but but let's just go back to that one real quick. So if someone were to go to you, and they want to get their body right, maybe they have some injuries going on, plus the migraines. Do you also add some neck and balancing strategies in their program
Yes,
alongside with fixing problems and helping them build their bodies up?
exactly. Yeah. So pretty much everybody that comes through my door has other issues. So um, it's very common for somebody to say, "Oh yeah, and also like my shoulder and like my trap, they just generally bug me." And that often can be something that's kind of sensitizing for people with migraines anyways. So um, I am particularly interested in helping people work around and through their injuries and make sure that they're getting um, a training routine that accommodates those things. So a lot of people are worried like, oh, well, I can't exercise because I injured my shoulder. Um, Lots of people I've worked with have seen very quick improvements in their shoulder pain, even just by getting into a routine that is mindful about limitations they may have going, forward from the beginning.
Hmm.
Yeah. So neck exercises, dynamic balance strategies, we call it VOR for vestibulo-ocular reflex. That's the combining your sense of movement and position in space with your eye movements. So, for example, let's say I'm staring at the camera and you turn your head and my eyes are able to track it. This is an example of the VOR, the vestibulo-ocular reflex, because without that, and a lot of people who've had maybe concussions or other issues will have a little bit of difficulty coordinating their eye movements with their head, and there's a lot of strategies we can use that can help to improve these, especially if somebody's having dizziness and like unsteadiness with your migraines, because that's a really common side effect of the aura, or a common co- comorbidity is having vestibular issues as well. So it's something that I tend to try to address if the person's up to it.
I did one exercise a while back, and we did one where I think it was holding my thumb up, I think, and then I would look around in a big circle, right? But making sure that the eye flawlessly passes through and not glitch.
Yeah,
So that'll be the wrong way to do it, right? If you have the glitching effect.
yeah. That's a really good introductory way to kind of assess like, are you having some deficits in your range? But I think even more effective if somebody wanted to try this at home. Actually, it's a nice trick to assess your capacity, and the baseline that we should see is somebody's ability to be able to stare at their thumb, and then I'll kind of demonstrate here, maybe out to the side. So you would stare at your thumb, and without letting it blur, without losing track of your thumb or letting your eyes kind of glitch off to the side, you stare at it and you go at 120 beats per minute. So basically 2 beats per second. And that's the baseline you should be able to do without getting dizzy and without losing track of your thumbnail. Um, that's an awesome one to do. You can also go up and down, and if you notice that you're struggling there, and really we should be able to go up to 180 beats per minute is the true passing that test benchmark. Um, but a lot of people need to start at like 120 beats per minute and then work from there. And so a great way for at home, if you think you may have some vestibular or some VOR issues, and maybe you get dizzy sometimes with migraines, that's a good place to start. And then if you notice some issues, maybe bring it up with your PT the next time you see them.
I've had some clients where they felt dizzy and I don't have them do the movement. And, it typically happens with older folks. And when they get up quickly, right,
Yeah.
that's when they start to feel dizzy. Another one is when I have them do a reverse crunch on a stability ball and they go back, head tilting back, and then coming right back up, creates that dizziness effect.
Yes. So
It has something to do with that.
those are both really good examples of areas where it might be due to that, but it could be due to another really common thing. So
Hmm.
standing up really quick, there's often a big change in your blood pressure if you have something called orthostatic hypotension, meaning when you change positions, either going from laying down to sitting or laying down to standing or sitting to standing, one of those require your blood vessels to accommodate to this increased demand in pressure from your lower body to make sure that the blood doesn't rush from your head down to your lower body. And so in older adults, it's really common for that to start to become a bit of an issue and that they get dizzy when they stand up quickly. But it can happen to a bunch of different people and it can happen for a variety of reasons, but it gets even more pronounced with certain conditions, especially cardiovascular disease or heart conditions, I mean. And the other one where they go back, there's two things that could be, and that there's a really common condition called BPPV, which is a type of issues with your vestibular apparatus. That's these little sensory organs in your ears, in the inside of your ears, that essentially, if something happens to that system and there's these little crystals that help you sense your ability to move, it's like a loop, and there's fluid in that loop like this, and you have three on each side that are able to then, when the fluid moves through that little ring, it moves these little hairs inside your ears that have rocks in them, and if the rock moves and gets into that fluid, it moves the fluid without your head moving and can make it feel like you're dizzy. So sometimes that's more common as you get older for that to happen. So that could be one of the reasons. Another reason is sometimes it is just the vestibular, the VOR system that I was describing a minute ago. But it can also be sometimes there's a blood vessel that goes through your neck called the vertebral artery, and it goes through the bones of your neck. So if you go into a position that's with your head really, really far back, it can kind of slow the blood flow to that, and it can make you dizzy. So that is something you don't really want to mess around with too much, but really not a big issue because it's more likely that it's the other things. But something that if you really get dizzy and you start to have difficulty talking or get confused because your neck goes back like that, that's a good sign that you want to see your physician and tell them about that.
And what about the position of your head? Because, there's also like that forward head going on.
Hmm.
It could be from, the cell phones. There's heads that are tilted to the side a little bit, right? And
Hmm.
so then, of course, the body then follows, trying to find a balance. Because, now it's getting complex. Now
Yeah.
we're talking about like the head positioning. What's going on there, and how did someone even get to that position?
Where they're getting some like the tech neck, like people on their phones kind of deal. Um, that's a good question. The challenging thing about posture is that, and it's kind of controversial, but we're learning more and more that posture, there's actually no one right posture, and for every individual, there's no one thing that's definitely going to um, be bad for them. So having a forward head may not be bad for on average, but it might be for that one person. So let's say you have migraines or you have neck pain or you get other headaches, and you can get something called cervicogenic headaches, where your neck pain refers up to your head, and that's through a process called cervicotrigeminal convergence. And that basically means that the innervation from your neck comes to this little nucleus in your brainstem and creates this sensation that pain is coming from your forehead, because these nerves also go to that same place, and the wires kind of get crossed in there.
Hmm.
Or the nerves get crossed is a better way to put it. But so this forward head position is only really an issue if it's specifically sensitizing for a person and they don't have options to get out of that position. So let's say we're sitting looking at our shared client here, and their head's really forward like this, and you're like, all right, sit up straight, and they're like, okay, I'm trying, but they're still really forward like this.
Yeah.
But let's say you say that, and they're like, oh yeah, it's not a problem. I just sometimes sit like that because it's comfortable. There's nothing wrong with somebody sitting like that, if it's a comfortable position and they have other positions available to them. The real issue comes from, and the time when postural corrective things may be valuable, is when that position is particularly painful or problematic for a given person. And so, like, let's say they're like, oh, God, every time I sit like this and I notice that I'm really stiff and I can't really get out of it, I'm starting to get more and more stiff, then it's probably a good idea to maybe do some things to address that, but it doesn't have to be something that we're demonizing. Having a bit of a forward head position is okay if you are able to get out of it and you're not having issues with it.
Yeah, I remember when, and I can see how controversial that is, by the way.
Yeah. Yeah.
Because the studies that I've been going through is a guy named Paul Chek, right? I don't know if you ever
Hmm.
heard about him.
Yeah,
And
it rings a bell. I forget.
yeah, well, he talks about how the head is like, I forgot how much it weighs, right? And having that forward
Hmm.
head and having your neck lifting that weight for a long period of time can create the tension.
Hmm.
Then you'll get some, I don't know, some discs problems in the cervical spine,
Sure.
and whatnot. But I think if someone has the knowledge that they're in that position,
Hmm.
I think that's the thing. If someone is aware of what they're
Yeah.
doing, aware of their body position,
Hmm.
that can be that won't hurt at all. Like, for instance, I know whenever I'm sitting crooked,
Yeah.
like I'm aware that I'm in this position and I'm just chilling.
Yeah.
But then what I do, and you can tell me if this is the right way to do it or not, but I'll do the opposite side. I'll start to move myself to the right.
I think that gets to a really important thing that there's, so, I think there's a bunch of ways we can kind of approach this, but the best position is a changing position. So if you find that you're uncomfortable in that one position and then you're like, oh, wow, I've been sitting like that for too long, that is your body's way of saying we need to change. So if you switch to the other side, that's a great way to manage that. Another great option is, people are often told that sitting is the new smoking.
I heard.
But in reality, we're finding that in the studies that investigate, well, let's just have people stand then. The people that stand and just stand all day at work have pretty similar issues that come about.
Yep.
But they're obviously a little different. But the best thing is to probably change positions frequently, so that, because it doesn't, the important thing to kind of emphasize here is that we're not saying that being in this position can't contribute to pain. It's that it doesn't inherently cause pain to be in that position. So what that means is some person may have difficulty with holding their head like this for a long period of time, and I would say most people would have a hard time doing that for several hours at a time. But the key is that we shouldn't be stuck in any position for any extended period of time. So let's say you have a sit to stand desk. Your change shouldn't just be that you sit for the first half of the day and you stand for the second half of the day. It should probably be you change from sitting to standing when you start to notice you're a little uncomfortable, and then you probably take a frequent movement break, maybe every hour, something like that. Maybe it's every 2 hours, whatever you need. But the most consistent thing we find in the literature is that it's better to have and this is also what I find with my clients. It's that you have a lot of options available to you for how you can approach this, but we know movement helps. Staying in one position for a long time is generally not good, and you have a lot of ways that you can approach that to match your specific lifestyle. If you are somebody who sits at a desk all day for work, you obviously have some different needs than the person who is standing at a factory line all day, and you're going to have different demands, but there's a lot that you can do to improve your situation. Basically based on, this idea that movement is we have a common saying that's, I think, purposely weird, but in physical therapy, we often say motion is the lotion. So,
Oh.
um,
Hmm.
so we basically are emphasizing that movement is helpful for getting everything moving and preventing those things of like, disuse, um, aches and pains coming up.
I will also say there's another saying that I won't remember, but it deals with your workplace. So it's like your body is shaped as the place you're working at. So, as an example, if you're at the grocery store and you're the person that checks groceries, right? You're checking everyone's product. That repetitive movement of grabbing the product, scanning it, putting it to the side, grabbing the product, scanning it, putting it to the side, and doing this motion all the time for a very long time can lead to someone in a distorted position. So they're like shoulders on the right side, shoulders back, left shoulders forward. Head is probably, still trying to find its horizon. And I can also see how lower back issues can also start to rise, twisting so much in that position, maybe twisting on the right side for so many times. Do you get people like that? Do you know if that's something that happens?
Yeah, so I would say that a good way to think of that is like it's kind of the opposite end of the spectrum. Staying in one position for too long is can be sensitizing to your your body's ability to sense. Your body has a pain is essentially your brain is assessing your body's status based on all of this information coming from all your nerves that are telling your brain about your different tissues in your body. So sitting can be sensitizing to those nerves as well as repetitive movements in the same movement. So it's kind of almost the same thing, just at different ends of the spectrum, because it's like if you're doing a really, really repetitive movement and it's the same thing over and over and over and again, that can end up leading to what's called an overuse injury. But it's essentially that your body has been challenged in a way that exceeded its capacity. So you kind of have this envelope of function, is what we often call it, where it's like if your if your capacity is here for a work for a resilience level, and you've been training and maybe it's gotten you this little window of capacity where your body's stressed and it dips down, but you come back out of it. You don't have pain, you don't have injury or dysfunction. But then let's say your window's too tight and then you are suddenly diving underneath this threshold of the bottom end of your envelope. And so you can essentially view that as we can build up your resilience by increasing the tissue loading capacity of a given area. Let's say kind of like your forearm. When you were having that pain in the forearm from maybe excessive gripping, but likely overuse in some way that it wasn't quite ready for. You can train it up with those exercises or changing how the nervous system is sensing that area, likely both of those things. And then you can build it up over time so that it's no longer as susceptible to those things. So if your job requires you to sit for a long time and you have really bad back pain and do that, there's a lot of things you can do to enhance your tolerance to that. Little movements, maybe even while sitting, just kind of shifting around or increasing your low back's strength and mobility in some ways or maybe it's you have pain from repetitive twisting at your station, at the factory, or at the, at the grocery store, and you may need to increase your movement variability or try different strategies for doing your tasks at work so that you're no longer doing that same stimulus. But the cool thing is our bodies do adapt to a lot of things, and we can get a lot better at a lot of things, and have a lot less pain with a lot of these things. So um, there's a good chance that they're not permanently anatomically shifted with their left shoulder forward. It's likely that they've adapted in a way, and it's mostly muscles and connective tissue, but nervous system changes are the big thing. They have a change in tone that's keeping them like that, but they can likely get out of that with an approach that gives them access to that range of motion again by training through their full range and creating some more movement variability options for them. But what it isn't is often people assume that they've developed a structural change. And there are some situations where people develop structural changes, like pitchers in baseball. They will actually have a slight change in the twisting alignment of their upper arm bone here, the humerus. So they have a change in their range of motion in rotation, but that is a positive adaptation, and they have developed the ability to mechanically advantage their position by having that increased external rotation, and they get an increased whip as they come through. And so it's a good thing that they had those adaptations, and enhances their sport and it enhances their performance. And oftentimes the changes we see that are slightly asymmetrical are something that is gonna potentially be beneficial for an individual. So it's probably a good idea to be a little bit cautious about being too concerned about subtle shifts in posture.
Wow. Damn. Dropping the mic on that one.
Yeah, it's something I get super passionate about talking about, because the number of people I've seen that are really, really stressed about a little shift in maybe in their shoulder blade, or maybe they've got a little bit of scoliosis, and when in reality we have pretty clear evidence that that's not necessarily going to be driving a lot of their dysfunction. And so I like to, talk about it, but I often get a little carried away. So I probably nerded out a little too hard there.
No, I mean, it's good to my ears. It's like music.
Yeah. Well, that's awesome.
But also, like, even like our bones are different sizes,
Hmm.
right? And
Yeah.
then we probably have a stronger arm than our left arm, so it's not like our bodies are not perfect and symmetrical.
Exactly.
Is what I'm trying to tell you.
Yeah. That's exactly right. Lots of people have anatomical variations side to side. Another classic one is people might have a different leg length. One leg might be a couple centimeters longer than the other, and as long as it's just a couple, or one, that is actually totally fine, and there's a good chance that you don't need any correction, and your body is adaptable and variable. And just because you have pain and you have that difference in leg length doesn't mean that that's causing your pain. It's likely driven by a lot of other things. And so, yeah, those little anatomical variations are what make us individuals, and are not to be demonized. We should be appreciating them for what they are, but then working around them and through them.
Thank you. Thank you
Yeah,
for
absolutely.
that, man. Wow. It's 1:20 now in
All
Houston.
right.
Where are you from again? I forget.
I'm from North Carolina, Asheville, North Carolina, but I'm living in the Netherlands right now, in Rotterdam.
Mm. Yeah, we're the time difference is so huge.
Yeah, I guess, no, 7 hour difference from where you're at.
Yeah. Jeez.
Yeah,
But thank you, man. Thank you for coming on to the show. I really
yeah.
appreciate your time, man. Like,
Thanks for
this
having me.
this is good stuff.
Absolutely, it's been my pleasure.
And a lot of people are gonna learn a lot from this. So
Well, I hope so.
yeah.
I'd be happy to talk more about all this stuff. It's something I love spreading the word about a little bit, and you know, definitely open to more chats soon.
Hmm. Definitely. So is there anything you want to leave for the audience?
Yeah, I would say.
Like maybe last sayings, and also where they can find you at.
Yeah, so you can find me at MoveWells on Instagram, and on Facebook it's MoveWells LLC. Um, but I'm expanding onto YouTube soon, and it'll be the same thing, and then I'll be on X as well. Um, but yeah, my I guess closing statements. I would say basically you don't have to accept the the condition that you're in, whatever it is, especially if it's migraines. I would be happy to help you with that. But all of these things that people struggle with, there is so much room for improvement in your capacity to do things, um, in your pain. These things can change, and all it takes is starting. And sometimes, it can feel hopeless, but having the right support, having the right systems in place to help facilitate behavioral change over time. Take it slow. These things take, consistency, and they need to be ingrained into your life. It's not a quick fix. These things are things that will absolutely change your life if you can integrate them. And um, yeah, I think the most important thing is to think holistically and be optimistic.
Thank you, Dylan. I appreciate your time.
Absolutely. Thank you.
All right, guys. We will see you on the next. Namaste.
Namaste.